second episode here at GSC, and today we have Kanchana here. I will let her introduce herself, and then we'll dive right into things.
Yeah, so, well, you already got my name. I'm Kanchana.
Yes, good start.
Good start. I've been coaching for 10 years now. Started coaching in India and then came to the US to do my master's in coaching education. And now I run my own business. What I most enjoy and I'm most passionate about is really helping people draw the link between lifting weights and like changing their entire health landscape. Essentially like lifting weights so you can stay out of the doctor's office, live longer, live healthier.
That sounds good. Sounds good. All right, so you want to talk about something specific today.
Lately, there's been a lot of discourse amongst female athletes and then also just women who lift weights about how they should be treating their menstrual cycles, whether there's a need to change what kind of exercises they're doing, how heavy they're lifting at particular points off their cycle. There's been a lot of questions, and fortunately, we have some research to kind of guide us towards how to answer these questions as well.
Okay. And so, I read the articles that you sent me, and I obviously have my own set of questions, but is there, when you were reading these, did you make like your own sort of hypothesis or your own kind of, even before you read the research, like expectations of what really was happening, and then did it change at all?
Yeah, that's a great question. What I really had to tease out was putting aside my own personal experience as a female athlete who menstruates and who's had like on the spectrum of like dysmenorrhea and bad menstrual cycle issues, and to kind of like look more at where the research is leading us. So where I wanted to go with it was specifically I'd framed it with two questions after reading like preliminary research. Firstly, I wanted to understand like, does the menstrual cycle impact athletic performance? Like N equals 1 is not a study. And obviously I'd spoken to women teammates in the past, but that's still not robust research. So that's the first question I wanted to answer for myself and for the women that I work with. And then the other question, based off of the first one, is there a benefit to syncing your training plan around your menstrual cycle? Is that a waste of time?
For sure. Okay, and so I guess what did you find, or was anything different from what you found?
Yeah, so I think in terms of the first question, does the menstrual cycle affect athletic performance? The effects are really trivial and they're very individualized. So those are the two primary findings from the research. And I want to explain that a little further. The individualized bit is you go across the spectrum of some women who experience no symptoms to women who have like debilitating cramps and nausea and gastrointestinal stuff and just all of it. The other piece of it being individualized is at what point in your cycle are you experiencing the worst symptoms? Because, I'm sure you've heard as well, right? Right? Like there are some women who just have really bad PMS symptoms. And then when you start the bleed phase, they're fine. Other women who actually have ovulation pain, which actually if you have ovulation pain, please see a medical provider. Just in case. And so you really cover a pretty broad breadth and variety of symptoms there. And then the second piece, which I'm now forgetting where we started, Scott, can you redirect me?
Well, I know that we were talking about, would you change your plan based on the different phase, right, that you're in? And I remember even before we started this conversation, one of the really interesting things that even while I was reading it was that the cycles aren't the same for everyone, right? And so how, would you even create the plan based on that? And would you, again, have to individualize everything, right?
That's a really great point. And unfortunately, a lot of the research that has been done in this area, they've assumed a 28-day cycle with ovulation happening at the 14th day mark. Now, this is not actually how normal human women who menstruate work. There's two things. There's variability between one woman to another in terms of like duration of cycle lengths. And then here's where it gets wild.
Okay.
Within the same menstruating individual, no two cycle or one cycle can be different from the
Yeah.
other. So you could be ovulating on day 14 one month,
Yeah.
and then day 16 or 17 the next month.
Changes, okay.
So that means your follicular and your luteal phase are not consistent month to month.
And does that, I guess, my question would be, does that indicate anything, or is it just like a normal part of life that it's going to be a constantly varying thing?
Yeah.
Yeah.
That's completely normal. In fact, it's just there's nothing to be concerned about there. That is actually a normal function of the menstrual cycle.
Yeah.
Is that there is some variation that we will see.
Okay. The other thing that I thought, and I don't know if you brought it up already, was that we talked about kind of like the unreliability of some of them, of the, I don't want to say experiments because that's not the right word, but the studies.
The studies, yeah.
And how like self-reporting was something. So like, while you were reading this, did you also think about like, oh, if I was going to do my own study, how I would do it differently?
Yeah, and I will say, it's commendable that these scientists have put the effort into studying this area, because we know that historically women have been ignored when it comes to medical science.
Yeah.
Specifically, actually, one reason why is because it's been thought that these cyclical fluctuations in hormones will impact study findings.
Okay.
Right? Like these fluctuations in estrogen and progesterone, for example. We now have more current research telling us that that is not in fact the case, and women should be included in more medical research.
Yeah.
So that's one thing that I did. That was kind of the frame that I read these papers with.
Yeah.
And I think obviously you do think about how you would do things a little differently. I think one thing that occurred to me was the detection methods were not robust in all of the studies. And what I mean by that is a lot of studies would use like basal body temperature to judge which phase of the cycle the participants were in.
Yeah.
And we know that our body temperature is actually impacted by many things other than our menstrual cycle.
I would imagine, yeah.
Right? Like, yeah.
Like, what if they're like just getting sick? You know, like obviously, I would imagine it would change that in their system. So yeah, I find that being a difficult way to reliably assess that. There was one experiment that used. You'll have to let me know, because they did a test every day.
Yes.
Right, and what was it again?
I believe that was actually like a luteinizing hormone test.
Okay.
Is that what you're
I think
remembering?
so. Yeah. Because like they were like that was the only way they could for sure detect what part of their cycle they were in.
Yep.
And I have to imagine that would probably be like really expensive and really demanding to take that test consistently. So that's probably like the difficulty.
Yep.
But I thought the other thing that was, you kind of hit it earlier, I was kind of fascinated by the fact that there was a report that they just straight up don't use women in a lot of the studies because they weren't sure based on like what cycle if it would affect the results in terms of like progress. And I was like, I feel like even if that was the case, it's still month to monthly the same, like over a period. So I was kind of shocked that that was the reasoning that I read. How did you, I guess, think about that or feel about that situation?
I think what is actually really heartening is that we know that the effects are trivial, right? So I think that's a good start.
Yeah.
And we know that, you know, the one thing, progress has been made in the area. Like there's more and more women wanting to discuss these things in a public forum and not just talk about it with their female teammates or female coaches. So I think we are seeing progress. It might be slow, it might not be as much as we want, but we are seeing progress, and I believe that that's the trend we're going to keep seeing.
Okay. And so I guess when you have a client right now, right, what does this conversation look like with that client? Because now that you've gone through this research and it's obviously a topic that interests you a lot, what does that look like, that conversation, I guess? Because I'm curious on my own, like how I would even have that conversation. And making sure that I'm open to it. But what does it look like from someone who's educated in this field already that would, I guess, how do you go about having this conversation?
Yeah, I think here's where the interpretation of the research is calls for a lot of sensitivity, especially, with like our current political climate. Asking women for their like menstrual health
Yeah.
is you want to be careful about how you do that, and you do want to make sure that you have a huge amount of trust already established with the client that you're
Yeah.
working with.
Okay.
The way that I like to do it is not at the start of the training process, because training is a long-term process.
Yeah.
Once, we've been working together for a little bit, or it comes up in conversation,
Yeah.
there's benefits to just tracking your cycle month to month. And there's a few instances where I haven't proactively changed things based on the cycle, but through our research, which is like the one-on-one kind of tracking of symptoms, we've realized that a few modifications help the client just stay consistent and stay positive as well. A good example is this one individual that I worked with. She would always have knee pain right around her PMS period, and it would be more sensitive to single leg loaded exercises. Yeah, and that's actually, it wasn't unique to her. I've had a couple more clients like that as well. And the big thing that helped the coaching process was we could now kind of have a rationale. So it went from like, oh no, my knees are acting up and I'm not able to do this workout, like I'm failing,
Yeah.
to like, okay, this is expected. So I felt this a little, and then the individual and I could work together to, hey, if this happens, here's a few modifications we're going to make. We're going to remove single leg loaded work. We're going to do other things. We might do more like hip-based exercises versus knee-based exercises.
Okay.
And all of that led to less of a reduction in training volume by just making smart adjustments to the exercise selection.
Yeah. So is it kind of just like essentially like if I had, a class member or a client who just has an injury in general, like kind of responding to it the same way, right? Just like adjusting to what that need is for that immediate moment.
Yeah.
And then I guess in that situation, are you seeing the same symptoms happen monthly, or is it something that can happen or could not happen? Is it changing?
I think that's the way to go about it, is to not assume pain or assume symptoms, because it's not consistent. That's the one thing we've established, right?
Yeah.
But it's more so it's helpful to know, like, oh no, my body is not falling apart.
Yeah.
I'm just about to start my period. Like,
Yeah, for sure.
Yeah. So just having that personal data was very helpful.
Okay. Yeah, I thought even reading the article and them talking about, and I said it to you like right before we even started, like it's fascinating to me that, an entire team of females had not had that conversation with one of their male coaches to be like, obviously they're not going to happen at the same time, but to not, I guess, bring up, and I think there's a whole other psychology to why you don't bring things up.
Yeah.
But I felt like, reading it from my perspective, I was like, oh man, like I think I would understand as a human being to be like, yeah, I get that you may be not able to do this today, so we can alter the training plan. But it seems like there's a lot of women who maybe don't feel comfortable actually explaining, how they're feeling in that space, and they just truck through it. And I think from the coach perspective, I was wondering how I can get ahead of that, because I don't know if women will feel comfortable saying those things to me as a male coach, right? And how I can open myself to have that conversation with them so they can feel okay having that with me.
I think that's such a great question, and it's one that all coaches should be asking. So obviously you're not going to impose that conversation if it's an individual you haven't met too much before. What I found helps is kind of just like being very casual about like maybe mentioning like, hey, if you're starting class and like, this is what we're doing today. If you haven't slept too well, if your knees are bothering you, if you have like stomach cramps, just come find me, talk to me. We'll work through it together.
Okay.
You know, kind of clubbing it as you would other quote unquote confounding variables.
Yeah.
Right?
Yeah, for sure.
Yeah.
Okay. Yeah, I just wasn't sure. I think sometimes I'm like, okay, is that a conversation that should be had or is uncomfortable to have, right? And I think that's also the part of it for me, like, kind of question. But I think, I'm curious also on your side because, like, I don't kind of watch the sessions that you have, right?
Yeah.
So I don't know if that conversation just comes easier for you at this point.
Yeah, I mean, a lot of my work is in one-on-one settings,
Yeah.
and obviously it's very easy to have that conversation then.
Yeah.
And I'm as like a woman who menstruates, it's always much easier for me to go in and have
Yeah,
that
yeah, for
conversation.
sure.
But I think as long as you kind of like give the signs that you're open and willing to discuss these things in like subtle ways, to me personally, that would make, like, as a woman, that would make me feel comfortable.
Okay.
Like, I actually do continue working with a male coach, and I know that I can always tell him about
Yeah.
any symptoms that I may be experiencing.
Okay. Well, sorry, I took us on my own tangent, but what else did you kind of want to discuss or dive into for this?
Yeah, so I think something that I did want to talk about was if you're a woman who lifts weights and you're confused about whether you can, in fact, continue lifting weights during any part of your cycle, because, our cycle is not just those 3 to 7 days that we're actually bleeding for, it's a whole 28 to 35 days of like your hormones fluctuating and naturally cycling.
Yeah.
But the research that we have available right now, as well as like kind of the translation of that from a practitioner standpoint,
Okay.
points towards like you don't necessarily need to proactively modify your training based on what phase of the cycle you're in.
Yeah.
Because the traditional recommendation is to maybe lift heavier during certain parts of your cycle, like your late follicular phase, not lift so much during other parts, like your late luteal phase.
Okay.
Essentially, if you put the numbers down, what that means is you're deloading every 2 weeks for 2 weeks.
Yeah.
Right?
Yeah.
And that doesn't make sense like for any kind of like long-term strength power
Yeah.
development.
Okay.
Right?
Yeah, no, for sure. Yeah. Like that would, 2 weeks of progress and then pull back for 2 weeks and then that would be insane.
In fact, all of the research we have on like detraining effects tell us to not intentionally deload for that long ever
Yeah.
if we want to continue making progress.
Yeah.
Right? What is a much more sensible recommendation, in my opinion, is the example I just gave of keep it individual. And that just comes down to also that coaching relationship to where you're working with somebody and you can help them deal with their own individual symptoms. Because there's going to be many women who don't have to modify anything.
Yeah.
Not a thing changes for their entire cycle.
Yeah.
And then there's going to be women who do need a few modifications. But the frame that as a coach you should go in with is not, like, how can I remove everything?
Yeah.
More so like, what changes can I make in order to maintain adequate training intensity and volume that will not hinder long-term development?
Yeah.
Does that make sense?
No, it does. I think it's interesting because I think the overall idea that I kind of consistently getting from this is that don't really change anything as an entire idea, but individually change it based on what their need is.
Individually start by just tracking.
Yeah.
And then change if necessary.
Okay.
I change actually, like with all of this. I'm a woman who lifts, and I have to modify my training plan nearly every month.
Okay.
There's a couple of days a
Yeah.
month where like I just am not able to push the way I need to like snatch and clean and jerk, and so I modify.
So how do you, I guess, discover, I mean, obviously it's something you deal with on a semi-normal basis, right? So like you can understand when it's happening, but like, I guess in that moment, if you come in that day and you're just like, I guess at what point do you make the decision to modify? Because like think from like my own experience I've had, with like coming off of injuries, it's like a coach would be like, okay, try this and then see how that feels and then continue, right? Or pull back if it's too much. Is it the same kind of thing for you?
It should be exactly the same.
Okay.
It shouldn't be, and the last thing I want women to think is that, oh, I'm on my period, I'm frail and weak.
Yeah.
Because for so long we've been discouraged from expressing strength and power.
Yeah.
Right?
Yeah.
Like, I mean, even now, like it's a hard fought battle to help women embrace getting strong and muscular and powerful.
For sure.
So I don't want any woman to think that just because I'm on a certain phase of my cycle, I shouldn't be lifting.
Okay.
So start with the premise that I can still do what I want to.
Yeah.
If that doesn't work, you're then going to shift to what can I still do to maintain my long-term progress?
Yeah.
Well, maybe taking a short step back. Easy examples are if you're not comfortable doing explosive work, like if you don't want to do plyometrics and snatches, for example.
Yeah.
Okay, can you do like machine-based work instead? Can you do seated exercises instead?
Yeah.
Can you do supported squats instead? So that way you're still getting some stimulus for adaptation, but you're staying within your comfort zone as well.
Okay, yeah, that makes a lot of sense. I this might be completely out of left field, right?
Okay.
So let me know if I'm way off. But I had a member come in who was postpartum, right? And the workout of the day had jump rope, like double unders scheduled, or not scheduled, but programmed. And she started and immediately was like, nope, this is not going to happen, right?
Yeah.
So is it, I guess, anywhere in the same realm of that field, or is it completely different?
That's a good question. That postpartum population is a little bit different because depending on what kind of birth you've had, you probably need a good deal of pelvic floor work after you've given birth.
Okay.
And you can still do jump rope, you can still run without experiencing symptoms, even if you're postpartum.
Yeah.
You might need a little bit more individualized, specialized work before you can do that.
Okay.
But that would be slightly different from this conversation,
Gotcha, okay.
for sure. It's a good question, though.
Yeah,
I
I
like it.
feel very ignorant in a lot of these conversations. So I think I go into it being like, okay, I know this is dumb probably, but I'd rather have the knowledge base, right, told so I can adjust to the next time when it happens.
I don't think it's a dumb question at all. No. And again, like I think it's important that all of us ask these questions.
Yeah. Yeah, totally. Okay. So we asked that question earlier, I think, right, of how you would design maybe the same situation. You've been kind of thinking about this. Did you, in your mind, actually have something you would design or you would use as an experiment?
Ooh, okay. So the thing with research that I'm learning is that you go in with this big fancy idea and then it gets stripped down because like, oh, that's not practical. Don't have funding for that.
Yeah.
Not going to get that many participants.
Yeah.
So you end up with like really, and I don't want to say watered down because it's still meaningful. And I think that's why it's so important to even have multiple studies on the same question, studying the same really question.
Sure.
Yeah. Because remember, like one study doesn't reveal anything to us.
Yeah.
One study just gives us a little bit more on a broader topic. But I think what I would like to see is, how would it change for women who are on some kind of hormonal contraceptive versus naturally cycling women? How would it change for women who have, so most of these, actually all of these studies examine eumenotic women, which is women who have quote-unquote healthy, normal periods. So that falls into that 28 to 35-day cycle. Women who don't have severe symptoms. But I'm very curious to study women who do have like dysmenorrhea. That word always trips me up. But that's just a fancy medical way of saying like deeply messed up periods.
Okay. Fair enough.
Women who have like, PCODs and ovarian cysts and things like that. That's something the research has not yet examined.
Okay.
So I'd be curious to see that. The other thing I'd be curious is like nutritional interventions to prevent losing training days. Like, there's some preliminary research there, but like, because the end goal is how can we modify as little as possible?
Okay. Yeah. I mean, that makes sense, right? To not have to be like making huge adjustments,
Yes.
right?
Yes.
The other thing that was, while I was reading the articles, was the other side of it, where elite athletes are honestly overtraining to the point of like not even experiencing periods.
Oh yeah.
And I guess how
Yeah.
do you feel about that? I shouldn't say feel. I guess how do you respond, or how would you adapt that? Because can you tell them to not train as hard, or is it more just because I think they said it was like an energy deficiency issue?
Yes.
Right?
So you would categorize that as secondary amenorrhea, which is when you lose your period for 3 months or longer after having gotten your periods for months or years.
Yeah.
So at that point, you losing your period is a sign of low energy availability, usually due to a combination of too much training, like overtraining,
Yeah.
and then not enough fueling. So if
Yeah.
you're undereating and overtraining,
Okay.
athletes that are specifically at risk are those that compete in endurance sports and weight class sports.
Okay.
Right? Because, like, think of athletes trying to cut weight or make weight, whether
Yeah.
that's weightlifting, even rowing, even though it's not a weight class sport.
Yeah.
But sports where leanness
Yeah.
is in your favor.
Yeah.
Endurance athletes, we see this in a lot, especially with those long distances, that volume that they rack up.
Okay.
Yeah.
So I guess if you had a client who
Yep.
was going through that experience, right?
Yep.
Like let's say they're training for an Ironman or
Yep.
something, right? Like how would you adjust? Do you adjust their training? Because at some point they
Yeah.
have to train to do the Ironman,
Yeah.
right? So do you just adjust like
Yeah.
the nutrition side of things or the sleep? I guess how do you attack that?
So in this case, and granted, I've never worked with elite athletes before, but this is serious. Like, losing your period, it's not normal. And unfortunately, a lot of coaches tell athletes that they're training hard enough so they've lost their period, and this
Yeah.
is now a good sign.
Oh.
Yeah, it's terrible.
Yeah.
The lack of information out there is like deeply traumatic almost, but because the way that we should be viewing our menstrual cycle is almost as like a sixth vital sign of health.
Okay.
And it truly is.
Yeah.
Because having just like regular periods is a sign that your body is functioning in a way that is optimal.
Yeah.
So not having your period, not having your cycle, the first thing we want to do is actually help the athlete eat more, like get more calories, fuel themselves more. And then that's a really difficult conversation.
Yeah.
So I've seen cases where you want to make sure that the athlete is well supported. So if you need to bring in like a mental health therapist, a sports psychologist, that is actually a great
Yeah.
intervention to have.
For sure. Yeah.
Right? Along with obviously a nutritionist as well.
Yeah.
Because there's things that need more specialized interventions.
Okay.
The second piece would be peeling back some training, making smart adjustments in volume and intensity as well,
Yeah.
while making sure that the athlete isn't detraining also.
Okay.
Does that answer your
Yeah,
question?
no, for sure. Yeah, it's fascinating because it's like, I think again, I as I think about this process, it really comes down to just like not making any assumptions whatsoever and really waiting for whatever the individual athlete is kind of going through.
Yeah, I'll give you like I had an example actually of one of my trainees did have a delayed period a few months in a row, and she and I were both concerned it was a product of because it's never just one thing.
Yeah.
In this case, it was training volume, but more so a severe lack of sleep. She had a small kid at home.
Okay.
And then just work stress compounded with like temporary like loss of family support.
Okay.
So it's all of these factors, one on
Yeah.
top of the other. So in that case, what we did was I helped her kind of design a nice like easy snack that she could eat at a time of day that she didn't normally eat. And then we changed her training pretty drastically, actually. Cut back her training frequency in a week, cut out all of her accessory work, had her rest longer, she did only compound movements and it was very much like intensity based, not intensity based. It was very much she could select the intensity she
okay.
wanted to
Gotcha.
work at.
Gotcha. Yeah, that makes a lot of sense. Again, I think I harken back to like that post-injury feeling, right? Where it's like you do something and you're like, oh, okay, maybe pull back. Yeah. Okay. Well, what else is on the docket for your questions here?
I got some notes that I wanted to make sure that. I think actually we covered everything that I wanted. I think the main message that I wanted to leave anyone who's listening with is that proactively modifying your training according to your menstrual cycle is going to do you more harm than good. Okay. It's going to rob you of training days. It's going to rob you of progress.
Yeah.
Instead, we want to be more reactive and auto-regulate, just the same way you would if you had a cold or you had an injury.
Did you feel like, I guess, I'll throw one more question at you. Did you feel like a lot of clients or women that you've talked to were preemptively changing their workout programs because of their period, or do you see it as common, I guess?
Yeah, I'll say luckily I've not had too many women who are resistant to training at all points of their cycle.
Yeah.
But I've seen this a lot with women I don't work with.
Okay.
I've seen a lot of questions. And what kills me is when I see practitioners
say don't. Yeah.
advise women to follow a cycle-based program.
Yeah. Okay. Awesome. Well, any other questions before we leave off?
I think I'm good, Scott. Do you have anything else for me?
I think I'm good. We'll have to see how my conversations go in the future. I'm a little curious, but hopefully good things. All right.
Maybe we can do a part 2.
Yeah, exactly. We'll come back in 6 months and we'll see how it went. Yeah. All right, awesome. Well, thank you so much for coming on. Hopefully we'll be back soon. And if you have any questions for us, leave it down in the comments for us, and we'll answer it when we can.
Thank you so much for listening. And Scott, thank you so much for having me on.
Of course. All right. Bye.
Bye-bye.